Hi, I'm Dr. Debra Kaysen. I'm a clinical psychologist and professor of psychiatry and behavioral sciences. Welcome to Viral Facts with Digital Medic. In this series, we've spent a lot of time speaking directly about the impact of COVID-19 and the vaccines that can stop its spread. This week, we also wanted to acknowledge the other effects that living through a pandemic can have, especially for your mental health. For many of us, this has been a year filled with lots of additional worries about getting the virus, about your health or loved one's health, maybe about losing your job. We've also had to adjust to a totally new way of life. Social distancing, for example, can be especially isolating for those living alone, and even for those who live with others. Spending more time together than ever before can put additional strain on relationships. It's also been a year with a great deal of grief, as many of us have lost loved ones during the pandemic. 4 in 10 Americans reported symptoms of anxiety or depression, which is about 4 times as many as before the pandemic began. Many people have also experienced difficulty sleeping, increases in thoughts about suicide, and increased consumption of alcohol and other substances. Stressors like poverty, debt, unemployment, and food insecurity may increase the risk of poor mental well-being during the pandemic. Other factors like increased physical exercise, increased perceived competency to cope with the crisis, more contact with nature, and being engaged in activities may help improve mental health. Individuals who already may have been struggling in terms of mental health symptoms, as well as health professionals, essential workers, communities of color, refugees, unpaid caregivers, and older adults, especially those living in long-term care homes, are those most at risk for experiencing mental health effects from the pandemic. So you may be wondering, what can we be doing to take care of our mental health? One of the best ways is to find your way back into the activities that bring you joy, connection, and a sense of self-efficacy. This is easier to do if you get vaccinated. Getting the jab will let you meet up in small groups with other fully vaccinated family and friends. And the sooner we all get vaccinated, the closer to normal things will feel. In addition to social interaction, other good ways to improve your mental well-being include staying active through exercise, eating a healthy diet, and keeping a regular sleep cycle. Some other strategies that you can try to improve your mental health is practicing meditation or mindfulness and engaging in activities, especially those that are meaningful to you or move you closer towards your goals. Sometimes our own inner dialogue gets in our way, like having our own inner critic narrating our experiences. Noticing that self-talk and shifting it in ways that are realistic, but are also more balanced and kind can be another helpful tool for getting mental health back on track. There are also some nice online apps and tools that can help you with putting these practices into place. With that said, it's still important to know that some mental health challenges may take more expertise than you might have on your own. Reaching out to a mental health professional is important if you're finding that your mental health symptoms have lasted more than a couple of months, or if you're finding it hard to function at work, at home, or in your relationships. If you're having thoughts of suicide, it is also a sign to reach out for help. Reaching out for help from a mental health professional should never be stigmatized. Just like you'd get an x-ray if you broke a bone, or you would see your doctor if you had an infection, you'll want to see a doctor if you're not feeling well mentally. The first step can be just talking with your primary care physician. For some of these types of concerns, that may be enough. For others, medication or talk therapy, like cognitive behavioral therapy, may be useful. Therapy doesn't have to take years. In many cases, it may just take a few weeks or months to feel better. That's it for today's episode. Take a look at the other videos in our Viral Facts playlist for more answers to your COVID-19 questions.